Welcome to the National Press Foundation. I'm Sonni, the president of NPF, and today we're talking about workplace mental health, a topic much in the news. I'm coming to you from the Evelyn Y. Davis Studios in Washington, D.C. National Press Foundation's mission is to make good journalists better. We're picking this topic today for a number of reasons, but partly because we think it's very much in the news, and our goal is to help journalists do a better job covering these very complicated issues. Today, I'm very delighted to have with me three very distinguished and knowledgeable guests. First, welcome Ron Goetzel from the Johns Hopkins Bloomberg School of Public Health. Ron directs the Institute for Health and Productivity Studies and is a fantastic source for journalists on these issues and also on data and studies involving mental health. I also want to welcome Lindsay Ellis, a reporter from the Wall Street Journal who covers workplace mental health and has written some fascinating and enlightening stories lately. Welcome, Lindsay. And finally, a very warm welcome to Rich Mattingly, who is founder of the Love You Project. In addition to endowing an award for mental health reporting at the National Press Foundation, the Love You Project has also just given out its first awards for employers for workplace mental health. It turns out it's hard to win these awards. The employers actually have to jump through a lot of hoops and really show that they're caring for their employees. So welcome to all of you. Let me start with you, Ron, first of all. This topic's been covered, some by journalists, but there's a lot of news and data about how much it matters. So why is this issue coming to the forefront from a business point of view, according to what data you're seeing?
Yeah, thank you, Sonni, very much for inviting me today. Appreciate that. Absolutely right. Mental health in the workplace has been an issue for a long time. In fact, we were writing papers about this going back 2 decades to be considered as part of overall health and well-being programs. It used to be called wellness programs or health promotion programs, and there was not as much emphasis placed on mental health and well-being as there was on other physical health problems like hypertension or heart disease or diabetes or eating healthy, being physically active, and so forth. I think the inflection point came about as a result of COVID-19, where all of a sudden everything stopped. The economy stopped and the business community realized that the health and well-being of my workforce, in fact, public health in general, plays a huge role in the success of the enterprise and our enterprise, but also the economy as a whole, as everything kind of ground to a halt as people stop working and stop attending to their day-to-day jobs and being much more concerned about their health, their family's health, community health, and things like that. So that direct line of sight, that connection, I think was made glaringly clear as a result of COVID-19. And we thought, of course, that, a couple of months, everything will be fine. We'll be back to normal. Obviously, that has not happened. We're still there. And employers are now, the business community are now dealing with, what do we do now? Is it a hybrid workforce that we want? Can people work at home? Should they be forced to come in the office? What are the advantages of being here at work versus working out of the home? And it's prompted a debate about what's the best way to work. And alongside, some employees said, well, this is great. I get my freedom. I can eat when I want. I can get up when I want. I don't have to commute for 2 hours. And I can kind of create my own schedule. While for other people, especially frontline workers, obviously they don't have that kind of choice. If you're in food services or in transportation or in construction and so forth, there is no work from home. You've got to be at work. So I think all of a sudden this became a hot topic. And there are other factors that are coming into play which are important to the business community. One is workers' rights. And we've seen an uptick in unionization activities just in the last 2 or 3 years. You go back in time, even 50 years ago, only about a third of the workforce, not only, but about a third of the private sector workforce were engaged in unions. Of course, in public sector, that was much higher. Nowadays, it's less than 10%, but we are seeing these efforts to develop unions, bargaining units, but also in the case of the railroad strike, where the workers said, pay and benefits and increases is all well and good, but what I really need is time off when I'm sick or I'm caring for somebody who's in my family who is sick. So couldn't you provide us with paid medical leave? And it's becoming much more of an issue as workers are saying, you know, I have certain demands and I have certain needs. Can you attend to those? One interesting study that was recently done by Gallup organization, where they interviewed about over 10,000 people kind of leaving their jobs and entering the workforce and looking for a new job. And they said, you know, what's really important to you in finding this new job? And as you might expect, number one was good pay, good benefits. Absolutely, that's what I want. But number two, quite interesting, was I want to have my employer care about my health and well-being. And for this to be an organization that actually considers employees' health and well-being. And of course, that can be extended in all types of ways. So we're seeing much more so kind of attention to work-life balance, issues that are relevant to the working individual, especially younger people entering the workforce. And I think what employers are beginning to say, well, what do I do? How do I deal with this? What are some ways to attend to this? And you'll come back to me later, but I've got some ideas about what they can do.
Great. And lastly, you had some interesting data about the connection between employers who take care of their employees' mental health and actual productivity, the bottom line. Can you just say a few words about that?
Yeah, we've done a whole lot of studies that actually show that health and risk factors, in fact, not even the conditions themselves, are related to diminished productivity. And that can be operationally defined as increased absenteeism, higher disability costs, workers' comp, safety incidents, and something called presenteeism, where you are physically at work, but mentally you're not engaged because you have depression, you have high stress, you have other medical conditions that are not being well managed. But we've also done another series of studies which are really fascinating, looking at companies that have good cultures in terms of health and well-being. Most specifically, one study that I'm very proud of was one where we looked at winners of the C. Everett Koop Award. And this is an award named after the former Surgeon General under the Reagan administration. And these are winners that were identified starting around 2001 through 2014. And we looked at the stock price and performance on the stock market of these companies. And it was basically a very small portfolio, similar to the Dow Jones Industrial Index, comparing these companies to the S&P 500, and found that over that time horizon that we looked at these companies that took really good care of the workers and had documentary evidence that they improved health and produced business outcomes, their stock performance was 3 times better than that of the S&P 500. So had you put your money in the S&P back in 2001, you would have doubled your money, had about 100% increase in the value of that portfolio. But had you put it in these companies that won the C. Everett Koop Award, you would have had over 300% return on investment. So that's just one study. And there are other studies that have also shown similar results of those companies that actually have adopted a culture of health versus the average company.
Okay, so Lindsay, this is your full-time beat. We're hearing about quiet quitting and all sorts of other sort of interesting worker responses. So can you give us an overview of what it's like to cover this and what you think the salient issues are that journalists need to be mindful of?
Sure, absolutely. And thank you so much for bringing together this panel. I'm looking forward to learning more here. So I cover the workplace at the Wall Street Journal and careers more broadly. Of particular interest to me are some of the youngest professionals, who are entering the workforce, what they're looking for, how they see work pertaining to their lives, issues of balance and the like. And I started at the Journal earlier this year and kept tabs, of course, on some of these corporate investments, initiatives that companies were rolling out, and tried to sort of parse what was, buzz and what was sort of substantive change. I think one thing that was quite striking for me was when I learned of this Surgeon General guidance from October, where America's Doctor basically said, workplaces play a key role in mental health and well-being. It was the first time he had weighed in on this for workplaces generally, and he connected it to two things. I mean, number one, your work culture can make an impact on your well-being and health, but number two, it can make an impact on workplace performance, which Dr. Goetzel was speaking to earlier. I think the sense of absenteeism, productivity, turnover, these have been really salient issues in workplaces widely, and the explicit connection to mental health was fascinating to me as a reporter who covers office culture and how workers are navigating their careers.
How many reporters does the Wall Street Journal have, your team, covering workplace issues?
My team covering management and careers, I'm doing a quick tally. There are five full-time reporters. Two of us are columnists, and three of us sort of report on the news. And I think that number was 6 up until a month ago when someone moved internally.
Mm-hmm. Okay, so major investment by the Wall Street Journal in covering these issues now. You've written interesting stories on the age, the way this has played out in different ways in different age groups, and particularly your can you just fix this story? So I'd like to invite you to talk to us about how you got that story, why you decided to do it, and I believe it's gone pretty viral. Tell us about the story and also what it represents for the United States at this moment in time.
Sure. Yeah. I mean, it was a really interesting one to do. I mean, and I get email, it came out a couple months ago, and I still get emails from workers, of all ages who kind of comment on this cultural aspect of work and how it pertains to their early career. I mean, we've seen data, from Microsoft signaling that after hours and weekend work have all kind of increased over the last 2 years. And there's one, seeing that from a data perspective is one thing. I mean, understanding what that actually looks like and actually feels like and what that means for someone's day-to-day experience with work is another one entirely. And so consultants and, young professionals in finance told me about what they call a please fix note from a boss note, one vowel in that, all the rest are kind of parsed out, PLS, FIX, in which at any hour, day or night, they could get a request basically saying, you need to change these fonts on 50 slides, or, hey, this table isn't quite aligned. And the expectation was you drop everything and you move on it. This is not a new phenomenon in the workplace, right? I mean, it's been a day in, day out issue well before the pandemic. This sense of not having clear scheduling, always feeling on call, that can weigh on workers. And I think what was really, I thought, helpful in reporting out this please fix story was that, calling attention to explicitly what it actually looks like and feels like, even if it is sort of a standard assumption, can cause people to take a step back and say, oh, wait, yes, I did bring my laptop on a Christmas carriage ride with my family, or, plan to walk away from movie night on a moment's notice. And, I think that moment of reflection was sort of fascinating to me as a journalist.
Just back to the Surgeon General for one moment.
Yeah.
This was pretty big news that the Surgeon General decided to put this in the category of, cancer and heart disease and so on. Can you say anything about, obviously hard to generalize, but what you think the reaction has been in the business community on the employer side to this being identified as a major physical health issue?
It's an interesting question, and I don't think I can speak to sort of employers' reactions writ large. I think in the weeks following this guidance that came out, I heard from a number of companies that were saying, we've stepped up our investment in this area. Here are some of the things that we're doing. I think as a reporter, the things that are most striking to me are, how much money companies are putting into this and for which sort of pockets of their workforce is it having an impact. I think kind of parsing out those reactions and responses, or even, if it wasn't sort of in response to the Surgeon General said this, so now I'm doing that, but sort of re-highlighting some of those notes. I think a focus on those numbers and those practical changes, I think, have been most telling on my end.
Thank you. So for everyone on the call, we are not a think tank. We will take questions at any time. We give preference to journalists on deadline. So if you're a journalist on deadline, please raise your hand or flag your Zoom hand. We'll unmute you and let you ask a question. I want to turn this now over to you, Rich Mattingly. Rich Mattingly is the founder of the Love You Project. And an organizer and a very interesting philanthropist. So Rich, tell me why you care about this issue so much.
Well, Sonni, first, thank you for the forum and for what you've done and continue to do to help educate not only journalists, but all of us on important topics like mental health. I spent my career at the Cystic Fibrosis Foundation working to cure a disease. And sadly, I lost my wife in a workplace tragedy. And that happened in 2014. As a result of that, I decided to retire and to study, if you will, what we could do to start addressing some of these problems. And as I began to study, it was really a group of young people between the ages of 25 and 35 that urged me to pay attention to mental health in this country. Often I've heard in Lindsay's commentary and Ron's some references to generational transitions and generational obsessions with areas. And it really was the message to me that generation cared deeply about something that my generation and older generations weren't embracing, and that's mental health. So if we wanted to make a difference as a result of this tragedy, that we would begin to focus on an area that we could have an impact. As I studied and learned and partnered up with some great academic institutions throughout the land, but certainly my good friends at Hopkins that I have come to partner with in so many ways now, they taught me that the workplace is probably the greatest opportunity to enact change, because so many of us between the ages of 20 and 65 or 70 years old, we go to work. We spend our weekend hours in the workplace. And what we could do at work, if we paid attention, would not only improve the workplace, but it would also improve home lives. It would improve personal lives. It would have a great far-reaching impact in so many ways. So the Love You Project became very focused. Our mission is focused on taking an unacceptable tragedy and turning it into a quantifiable agenda and responsible actions. Talk is cheap, I say, but if you can make a difference and you can begin to document your difference, you can impact those that need you. And so the workplace and mental health is our focus. The workplace is specifically where we pay a lot of attention. The Journalism Award was born out of really frustration among medical professionals that said so often to me, boy, and I was living it, I must say. There was a lot of attention being brought to crime as it surrounds these tragedies, the mass shootings, in our case, the death of my wife. But there was frustration among the medical and the research organizations about the fact that there wasn't enough attention being placed on what the problems were, what the potential remedies were, who can affect change and the like. And out of that was the beginning of the partnership that we have with the National Press Foundation and the establishment of the Carolyn Award for Mental Health Reporting. And I'm extraordinarily proud to say that award has done a lot of good things. Not only do we recognize now tremendous work, tremendous journalistic work, but often those stories or bodies of work have resulted in impactful change within the communities or within the nation that have made a difference. And as you referenced earlier, with Ron's help and the help of a great advisory committee, we established the first workplace awards this year and presented them to 3 very outstanding organizations that are doing good things. America is begging, particularly industry, is begging for help. What are the answers to these challenges that they're facing? How can we help our people? And if you take, I was particularly drawn to a comment made by the Cigna CEO recently David Cordani, where he said in a Fortune publication, employers now have this front and center. They understand the impact, they see the impact in workplace management, preteeism, productivity, and turnover. And he summarized by saying, so whether an employer is looking through this through a philosophical lens or through a business lens, he comes to the same space. So the Love You Project tries to glue together these opportunities to make a difference. And through my great partnership with Ron and the good people at Johns Hopkins, through the great partnership that we have with other players that we work in. And I must mention one other thing, and that's You Lead. We believe You Lead is a component of our organization that focuses on young professionals. And young professionals will in many ways rise up and carry Lindsay's message, Lindsay's work into the workplace. So we have great faith that these people are going to be the messengers and are carry the payload to make into an act change. And obviously, I have great affinity, the Love You Project does, for what we're doing journalistically and what we're able to do to educate and to bring people along in the thinking process for what can be done.
Okay, I'm going to stop for just a sec to take a question. Not from a journalist, but let's just decide who will be best to answer this. A big fan of all three presenters. So it's one thing for companies to be pro-wellness when budgets are plentiful. What, if anything, are you seeing companies doing differently during these times of layoffs and inflation, especially at a time when the wellness coordinators themselves may feel their own internal pressure? Ron, do you want to take a crack at that one first and then Rich?
Sure. And yeah, I mean, as long as I've been involved in this field, budgets are never sufficient to take care of the problems that are out there. There's always, we're in bad business straits, which is not always true. But I think there are many things that can be done that don't cost a whole lot of money, and they usually revolve around policies. What are your policies, let's say, about overtime, policies about job rotation, about being able to take leave, for medical issues, being trained in a career path that's meaningful to you. And there are, things even like in stock ownership programs where, again, it doesn't cost much money, but really does engage and involve the workers in success of the business. There are also ways of creating what are called ERGs, or employment resource groups, people with similar interests getting together, whether it's books or childcare or elder care or some cooking classes, whatever, getting together, but within those groups, inserting information that's relevant to mental health and well-being and empowering people. I think that is one of the easiest things to do. It's very hard for management, but giving them access to strategic decisions and decision-making and engagement, and saying, this is something that would really help me. I don't necessarily need a new $5 million fitness center, but, if you could provide me with tips on how to cook well, or, even some meditation, or better access to the EAP program, which I know is there, but I can't get to it. There's so many things that can be done within the umbrella of mental health and well-being, but they ought to be considered within three broad buckets. One is what can be done on a personal basis to address psychosocial issues like anxiety, depression, lack of sleep, lack of physical activity, and so forth. But organizationally, there are lots of factors, including scheduling, the demands that are placed on people, the resources that are provided to people, the amount of autonomy that they have, but also things like toxic bosses. Those will really make your life quite miserable even if everything else is provided. And then there's a category of environmental factors that companies ought to be paying attention to. And that's anywhere from the physical space. Are you sitting in a crowded room with everybody talking and yelling and on the phone at the same time? Do you have opportunities for privacy? How about too much heat, too much cold, fresh air, fresh water, clean air, clean water, exposure to virus? What are the procedures that we have for COVID here? So there are multiple things that can be done actually with relatively little cost just by changing things around structurally.
Question from the LA Times. Yes, we are recording this program. Everything is on the record. We will have a transcript afterwards. But if you're a reporter on deadline and you need a quote, please reach out in the chat, and we'll make sure that you get an audio recording, right after the program is over, so that you can quote our speakers if you want to. And we're still open for questions, so please raise your hand or your Zoom hand, or drop a message question in the chat, and we'll try to get to as many questions as possible. So, Lindsay, let me turn it over to you for a minute about toxic bosses. Toxic bosses, it's like a meme now. How do you define a toxic boss, and how do you cover a toxic boss? How do you decide, and who gets to decide what's toxic?
Sure. So I think one area, when we decide sort of how to weigh in on these conflicts, I always really like looking at kind of what either documents, policies, or the like, what can we read and see firsthand? My colleague Ray Smith and I earlier this fall really took a deep dive into something as simple as the job listing. What sort of words or phrases in those were signaling something to workers that, might have been intentional, might not have been intentional on a manager's part. Things like, always be willing to hustle, or, some managers saying very explicitly, some folks I talked to, I want to respect your boundaries. Seeing sort of what signs, what flags were making it all the way into that introductory job posting. That was sort of one way into the question of how do you tell what a team is going to be like, or a manager is going to be like. I think in terms of coverage, really understanding the dynamics of a team, giving everybody the opportunity to comment who might be, cited in an article, that's really critical to make sure you're understanding an issue as deeply as you can before you move forward. Those are some ways that my team and I have thought about it.
Okay, thank you. So I promised I wouldn't make this all about Elon Musk, though it's tempting. But we have a question in here that comes to this question of the perceived or real trade-off between the economic value and the mental health. And the questioner says, there's a lot employers can do to support the mental health of workers internally, but looking at an even higher level, in what ways does the very nature of our economic model, which often prioritizes profit incentive decision-making at the day-to-day and organizational strategy level, may come at odds to the mental health of workers? Rich, you've patted both sides of this, because you've been a big employer as well as as well as an organizer. How would you describe this perceived tension between, profit, the profit motive, the hard driving boss, the hard driving successful company, and the mental health of the workers?
Yeah, it's a complicated issue, but in reality, it's becoming clearer all the time. And I'll reference again the CEO at Cigna that said, whichever lens you look through, it comes back to the same result now, and that you have to address mental health for your people. Ron and I have participated in a number of scientific discussions and with experts from around the world. And there will be a reality check after having these discussions sometimes, when a chief medical officer stands up and says, hey, the theory that we're approaching here is quite good, but in reality, my CEO is going to ask me what this cost, what it's going to be to make an impact in terms of dollars, and what's going to be the result. What we are starting to see, and I'll yield to Ron for the specifics on this, but what we are starting to see is more and more evidence that, in fact, if you pay attention, and really to address mental health in the workplace, one has to, the management team, the C-suite needs to adjust mentally. They need to be willing to take on the challenges of some very tough discussions that are going to say, we might need to go down some paths that are going to cost some money. What's the short-term cost? What's the long-term cost, long-term benefit, et cetera? But what we're seeing more and more is that those that take those roads have a happier workforce that produced better, as Ron cited earlier, EBITDA, dividends, and the like, are all in better condition for those that take better care of their people. And if you look back and you start slicing the pie into different pieces, you clearly see that with the younger generation. With the generation that's coming into the workforce, it's going to be running the workforces of the future. You see their mentality embracing that. So clearly it's a discussion that happens, is going to happen for a long time, about what it costs and what the return on investment is. But if you look at the facts, and again, there's anecdotal discussions all over the place, but when you start looking at facts, and that's one of the reasons that the Love You Project is so sincerely focused on working with good academic-based and business-based research, is we want to get the science, the underlying science, better understood and applied as it relates to workplace mental health, not just anecdotal theory.
So, Ron, tell us about the science, because we continue to hear about bosses, at Twitter, saying, if you want to be on this team, you have to be all in. Otherwise, go away because we don't want you, period. And, so it sounds like the country, there's maybe some bifurcation between the people who believe it and the people who don't believe it. Can you talk a little more about why you think the science is so strong? And what would you say to the hard driving bosses that says, hey, if you can't hack it, I just don't want you on my team?
Yeah, now this discussion has been going on for decades. In fact, if you go back to the 1970s and Milton Friedman, where he's basically said that the only responsibility of an organization is to make money for its shareholders, and that's it. You should not be spending any money on anything else. Well, in many ways, he had to take that back later on, because there's ample evidence from many, many different studies and sources that taking care of your workforce actually does improve your profitability and your longevity as an organization. And it's a missteps that actually get you into a lot of trouble. And I think with Twitter and what's happening there right now, it looks like a toxic work environment to me. I'm not going to second guess rather the smartest quote unquote and richest person on the planet. But that's not the way.
He's been demoted. Excuse me. He's been demoted. He's now the second richest since buying Twitter. So,
all right. Well, in any event, he's much richer than I am. I know that. But what he's doing is counterfactual, essentially, to what a good manager and a good boss does. And there are dozens of books on the topic, but also a lot of data research showing that companies that are very much focused on their workers and their well-being do better. I used to work at Johnson & Johnson, for example. They have something called a credo that they developed over 100 years ago. And when they look at the relative priority of different stakeholders, number one is the patients, the people who are their customers. But number two is the employees. And number four is the shareholder. And that's worked well for them by and large over the last 100 or so years. We've done several literature reviews on the subject of mental health and well-being as part of a new center of excellence that was funded by NIOSH, which is the National Institute of Occupational Safety and Health. It's called the Poe Center for Total Worker Health, focused on mental health in the workplace. And Poe alludes to Edgar Allan Poe, who's from Baltimore, who was quite morose at times, especially in his poetry. But it also stands for POE, with P standing the personal psychosocial elements of mental health and well-being, O, organizational health issues, and then environmental health issues. And what that means is that oftentimes employers say, businesses say, yeah, you've got a mental health problem, we've got an EAP, go talk to a counselor and you'll learn how to cope with it. And, we'll teach you meditation and resilience and grit and, let you sleep longer and things like that. But the O part, the organizational part says, no, wait a minute, we're expecting you to work 12 hours a day, get emails in the middle of the night, respond immediately to things, high job demands, low resources, low autonomy. We're not really interested in what you think. The hours are ridiculous. You don't own this. The wages are lousy. You don't have access to outside resources. And then on the environmental side, Well, what about your physical space? You're sitting shoulder to shoulder to somebody else who's occupying your space, and they're yelling on the phone to somebody, and you have high temperatures and cold temperatures and no windows to open, and exposures to chemicals and bad water and bad air, and and exposure to COVID. So all of these things come into play together. And it's really not enough to just take one at a time and try to solve it. You've got to look at it in a much more holistic and integrated fashion. And that's what we've been doing as part of the Center of Excellence with NIOSH. And a lot of it was inspired by Rich Mattingly and his work with Lovely.
And Sonni, if I might add, we often think of the C-suite or executives having the control and making the decisions that impact the masses. We've seen evidence where the C-suite benefits from good mental health practices. And when you can exercise good practices that help your management team, that trickle-down effect is very powerful. And over and over again, and we partner with one of our great leaders, has given us examples where that has worked over and over again. So I'll tell you, workplace mental health isn't just the workforce out there, it's the C-suite down. And if you can take someone, let's keep in mind that depression alone is the leading cause of disability for people between the ages of 15 and 44. And depression touches everybody in some way, shape, or form. But if you can take depression and addiction, which is so rampant in our country in different ways, and you can help people get better and preserve their ability to work and to excel at work, you can demonstrate for everybody within the workplace that it's not something you have to be afraid of to take on a healing process or get help.
So we'll turn to a question from Los Angeles, from the LA NPR station, KPCC. The journalist asks, I'm wondering if the necessary shift to work from home has brought new mental health concerns. I'm thinking about isolation, less camaraderie, and how this has affected workers. Any suggestions for people as they manage returning to work or hybrid schedules, et cetera? And let me just add, how many people come to work because they just want to see their friends? And there's like no other reason why they would really bother. They maybe need the money, but really they're coming to see their friends. Can you talk about how that plays in and what happens when people start coming back voluntarily or involuntarily?
Yeah, I'll start, and others, of course, can comment. I think there are plus sides and downsides working remotely. There actually has been some research that's been done on this, and at least initially, people report being more productive. We've seen that in some of our studies, and largely because they don't have to commute. They have a lot of flexibility in their scheduling. They can take care of kids if they need to. They can work late in the evening. So they like that sense of autonomy. But I think the issue of camaraderie is really important. Because you have friends at work, and it's important to have friends at work and people you like to interact with. And frankly, being on a Zoom call for more than an hour for me is just, my eyes glaze over. Whereas you could spend a day in a conference room brainstorming with other people with breaks here and there and really be very, very creative. I think the problem has been that in a hybrid situation, people come into the office and then they sit in front of their computer doing Zoom calls, which makes no sense at all. If you're going to organize this in a smart way, you'd have days that people come in for group activities that involve the work. You'd have times for social activities, but you'd also have space either at work or at home for, nose to the grindstone focused activity, which is, most of us need that in order to get our work done. So if you organize it in a much more reasonable way where you are interacting for the benefit of the organization or the benefit of your own mental health and well-being, but allow people some level of flexibility to focus, I think that's the best model.
Lindsay, how are you seeing this play out? You saw Jamie Dimon saying, people have to come back. I don't care if it's bad for their mental health. And then you see employers who backed off that policy. Who's winning?
It's a tough question on who's winning. I think to quickly just tack on to Ron's point on friendship and engagement in that sense. One place I've looked, journalist to journalist, is Gallup's engagement pulses, which they've measured engagement in 12 different ways, including do you have a best friend at work, and those types of measures, and the links there between those questions and engagement, and then productivity and turnover and those aspects writ large, that can be a good place to turn. I think my colleagues have done great reporting on just the various ways workers and their managers are clashing, and some of them are on these return to work issues. There's been sort of a push and pull over the last 2.5 years, in which employers keep setting deadlines. In many respects, those have been pushed back or modified, but you do see some companies taking a firmer stance, especially in recent months, as labor leverage, the tides are turning somewhat in certain fields. So I think that's one area where there's been a clash. I mean, pay and how pay compares to inflation. I think that's another point of contention. I think it is hard to sort of answer the question who's winning directly, because I do think it really depends on so many factors: industry, size of the company, and the like.
What do you think some of the big stories are going to be coming forward in the next year? I mean, we've talked about return to work. We've talked about unionization. And the role that, for example, paid sick leave has and other kind of mental health or wellness, bathroom breaks and just general sort of environmental health and safety issues that Ron raised. What do you think some of the other sort of flashpoints are going to be for journalists to keep an eye out for in the year to come?
Sure. I mean, so I think first is I learned so much from readers writ large. So for the non-journalists on this call, if you have thoughts and opinions on this, please send me a note. I'd love to hear from you. I think, the things that I'll be keeping an eye out for, I mean, how jobs numbers change, employment reports change, who has a job, who's looking for a job, and what fields there are layoffs. Those are going to be key things to track. I mean, on the mental health spending side, the consultancy for benefits company NFP they track sort of companies' projected spending on these issues. I think finding any indicators on what companies are actually putting into this, that will be really helpful. And I also love talking to employers about how they measure what's working and what's not. That's sort of a key question for me. Are you taking pulse surveys? Are you having town halls? What types of qualitative and quantitative feedback are you receiving? I think continuing to ask those questions to some of the companies that I interview will also probably put forward key trends.
Okay. A couple more questions coming in. Okay, so in academic research, the role of psychosocial risk factors on mental health have been well documented, but it seems employers are only just starting to address their own cultures of work beyond more therapy and self-care. So what explains the lag and what's catalyzed the shift? And Rich, can you talk a little bit about the culture of work? Because I know this is something that's interested you.
It is, and I'm glad to say that I agree with the fact that the workplaces are beginning to look at themselves. Culture, again, oftentimes you go back to generational. You were raised to be tough and to fight it out, and if you have a problem, keep it to yourself. And the word we haven't used today is stigma. And stigmas are real and huge in the field of mental health. We must address them to be able to collect more information and more data and to approach these problems. And we've got to break down the walls. Now, I think some of that's beginning to happen. The sheer fact that we're online today and that Lindsay's doing her work, there is more open dialogue about mental health. Those of us that are old enough can remember when candidates, it was learned that they had a mental health issue, they had to drop out. They couldn't be considered a legitimate candidate for office. Or a senior manager within a big corporation in this country. Those times are changing, not fast enough. I wish we could snap a finger and things would get a lot better a lot sooner, but nothing that's worthwhile is easy. We must fight. I think that stigma word is one that we've got to embrace and begin to continue to chisel away at it within the working environment. If you do that, again, behavioral and mental disorders have well over a $200 billion impact on the workplace. And that's old data. That's good data for, I think it's around 2010 or 12 or something. I'd have to look it up. But when we were building the original summit for the workplace and the relationship at Hopkins, we went into all this data in great thing. So there's no question the economics are there to make an impact. But beyond those economics, we have to deal with this stigma issue. And the stigma issue in some places, because management is willing to address it. I sat down with the CEO of a company not long ago, and to my surprise, had a very candid conversation with somebody who said, I'm going to deal with this in my workplace because I've had to deal with it at home. And I'll tell you, what he is doing in his workplace is state of the art. It's based on good scientific, evidentiary-based practices as best he can, and he's hungry for more information. I hope we don't have to rely on everybody having a bad experience to get on the bus. But if managers will embrace the fact that we all deal with mental health, it is a part of our world, everybody. I mean, the data will show 1 in 5 Americans have a mental health diagnosis. But that data is conservative, and some people would challenge that there are far more. But if just 1 in 5 of us, that means it touches every one of us.
You've talked about the generation, the pace of change, and how sometimes it takes decades, in fact, to make change happen, or to make these cultural changes happen. For example, seatbelts. Can you talk a little bit about the time frame that you see that is required to make these changes?
Well, that's one that's been a great discussion point at many conferences that I've participated in, and as a student, again, I'm a far better student at my age today than I was when I was in college. But I am learning what has transpired in our country and how some of these things were addressed. Seatbelts was one of them. Babies putting children, toddlers in car seats, sprinkling systems in buildings where there were fire. I mean, if you look at the data, buildings that were built pre-sprinkling system, people could die and often did. Since the modernization of the way we address fires and the like, you've seen massive improvement, smoking in America and the health risk associated with it. Much of that evidence, that data came out pretty black and white, but it took an acceptance, a generational transition of saying, these are the things that we need to do. Thankfully, today, people are adjusting and seem more willing to adjust at a little bit of a faster pace. But I wish I had the answer to the question, Sonni. I don't know how long it'll take, but I hope we can compress it by opening the channels of communication. That's what's so important about the press, the work of the press. We've got to educate. Education leads to better digestion of information and a comfort with it. And if we can get the discussion, people, journalists in your field, again, as a victim, call me whatever you want. When a crime is committed and you lose someone you love so dearly, that means the world to you, and it happens in such a public way as ours did. Everybody wants to write about it. They want to know how you feel. What you really want to do after you suffer is you want to, at least many of us do, I don't want to speak on behalf of everybody, but what we wanted to do is to say, how can we take this bad thing and open it up and not talk about the crime, but talk about the opportunity to maybe create a path that somebody or lots of people won't have to go down our path. And in doing so, maybe we reduce, if we're open and very candid about the conversation, help some other people say. And I'll give you one other example. Daily, somebody will approach me, if not multiple times a day, and say, hey, I appreciate the work of the Love You Project and what it stands for. And I'd like to help you. Let me tell you why. Because I have someone in my family that's depressed. I have a suicide a child that we lost to suicide, or I have an addict that I love dearly that I'd like to help. But Rich, please don't let this go anywhere. Just leave it between you and I. And I always say to people, your confidence will go to the grave with me. But please think that if you talk about this, if you help open the dialogue, if you help educate and bring the discussion to a higher level, we're going to make progress. If we all turn away and keep it quiet, we're not going to make any difference. I think that applies in the workplace, in the C-suite, at the water cooler, at the dinner table, all over.
We have a number of questions coming in about various iterations of the question of what works. So Ron, let me ask you if you could take a crack at it. Or folks in the chat are asking about full service employee assistant programs, about the Canadian standards that Canada's a leader for trainings and certifications in this area, and also this workplace mental health movement you mentioned, like meditation apps or trainings or whatever. Are in terms of commercial solutions, for workplaces? What's the evidence about what works and what doesn't?
Yeah, it's a great question, and I'm also referring back to your previous question of what's going to make news down the road. I think up until now, the conversation has basically focused on the individual and what the individual needs, whether it's counseling, resilience training, meditation, sleep, and so forth. It really has not addressed what the organization can do from a variety of aspects. And I think what's going to be news and interesting is what are organizational initiatives and interventions that matter. And they can be, anywhere from, as I mentioned, scheduling and overtime and sick leave and childcare and career advancement, ownership, fair wages, benefits, remote work, and so forth. And then the whole set of environmental factors. I think what's going to change is, rather than us knowing about the problem and acknowledging it, which is absolutely necessary for everyone to do, identifying best practices and identifying who's doing those best practices and how they got there, kind of the how-to guide, the very practical approach, and highlighting and recognize organizations that have done it. The winners of this year's Carolyn C. Mattingly Award, one is a law firm, Aiken Gump in Washington. Another is a school system in Nashville, the Metro Nashville Public School System. Another is University of Virginia. So very different, diverse workplaces, and yet they have done an outstanding job, and according to our criteria, actually have very, very successful programs. So highlighting, recognizing them, and taking the lessons learned as case studies that other employers can emulate and also be recognized for doing a good job.
And the criteria, when the review committee looked at the criteria of all of the submissions, they offered back to each of the companies a critique, not only highlighting what they did well, but areas they can improve. And that information is being shared. So we grow when we work together.
Lindsay, did you want to talk about your reporting and what you see of this question of what works, what doesn't work, what employers are open to doing, and what you see happening in this space?
Sure. I mean, I think one key area that I have been starting to see is, employers saying, we're going to bolster headcount and add people to a team that seems overwhelmed. The software company Kajabi told me earlier this fall that they were getting sort of internal survey results that showed that people in certain areas were overwhelmed. And one area that they did in response was to add headcount and sort of reshuffle who did what work. I think that's a different investment than, converting PTO days to a mental health day. While, I mean, I think that's certainly newsworthy and interesting for some of the stigma questions that we just talked about earlier. I mean, the sort of addition of bodies and making sort of wider structural changes to how organizations function, I think those types of announcements to me, are incredibly interesting. So it's something that I have an eye out for in the future.
Okay, we're coming up to the top of the hour. If there are any last questions out there, please raise your hand or drop them in the chat. Let me go back to this subject that Ron raised, which I think is fascinating, which has been the propensity to put responsibility for the mental health of an institution or an organization on that one individual. If you were meditating enough or you were getting enough sleep, then we wouldn't have these issues. And so you shouldn't be staying up till midnight playing video games or whatever it is. And then you have that extreme. And then on the other hand, you have these acts of individual intense violence, workplace mass shootings and things like that, which unfortunately, seem to be becoming more frequent. What can we talk about taking this out of the realm of the individual, whether the individual's ill or the individual's violent or whatever, and talk about it more, at the societal level in our country? Rich, you want to have a go at that because you've thought about it?
Well, that's a tough one, and that's a very good. I'll tell you, when you start studying and, as I said, become a student of this work, you learn that there's a key word, certainly in public health, that's critical. It's called prevention. There are ways that we can prevent a lot of what transpires in the way of tragedy, in the way of violence, in the suicide arena, through preventive action. And I have heard that through listening to the great academic minds. I've heard it by listening to governmental minds. And more recently, I've heard it from the mouths of individuals who have lived it and want to express their feelings. So I'm a big believer, again, it goes back to education and breaking down these walls, these stigma associated with this dialogue, that we can prevent a lot of this. Now, not all of it. There are a lot of factors. There's a lot of data that suggests there's pathways, there's trends that evolve in these tragedies. And one could get into all the different discussions that would go many hours beyond what we have here today. But there are ways, and there is evidence that in certain ways, if we deal with these things, we can, through the scientific best practices that are evolving, that we can prevent some of this from happening.
Yeah, and Sonni, I think it is a broader societal issue, but people, 150, 160 million Americans go to work every day, so they spend a large chunk of their waking hours at work. So I think there is an important role that employers can play. Oftentimes, these people who do these crazy things, put crazy in quotes, violent events, these people are feeling left out, not noticed, not important, not engaged, not part of, a broader community. And I think there is a lot that can be done, at the workplace to identify, number one, those people, make people aware of that, and then put in intervention programs that do engage them and do bring them into the fold and make them feel relevant and important to the work. But there's so many things that can be done at the workplace, but also on a broader societal level, because we are in many ways drifting away from one another. We've got to come back together again.
And you've got to also, people need to feel more comfortable in calling out or being able to provide the appropriate people with the signals that scare them. When we go through a TSA line, it says, if you see something, say something. You really have to almost adopt that in the workplace. And you need to do it in a way that it's not, you're not scared. You're not going to be labeled in some way, shape, or form, and you're not going to do a disservice. No, no one should want to do anything to harm anybody, only to help them, and to do it in a confidential, respectful way that allows us to improve. And That's one thing I'll give government credit for, is that when you pass through a TSA, it says, see something, say something.
Well, I want to thank all of you so very much. Lindsay Ellis from the Wall Street Journal, Ron Goetzel from Johns Hopkins Bloomberg School of Public Health, and Rich Mattingly from the Love You Project. Thank you for your time. And to all of those who joined the call, thanks very much. We'll have a transcript up and quotes if you want them. Thank you so much.
Thank you.
Take care out there, everybody.
Take care. Bye-bye.